Good morning, good afternoon, good evening, wherever you are, and thank you very much for joining this webinar session on EVM. What does EVM tell us about the evolution of immunization supply chains from 2010 to 2022? Paul Colrain is going to present you this session. He's going to start like in a minute or two. During this presentation, you can ask your questions in the question and answer box. And we also record this session. This session is recorded in French and English, and we will share the links by email so that you can watch it again later. We'll share also the presentation. That's it for me. Paul, the floor is yours.
Thank you, Alex. Good afternoon, everyone. I'm very happy to be here and to present some highlights from the EVM1 global data analysis up to 2020, actually not 2022. But I will give you a preview of what EVM2 will provide in terms of data and data analysis tools for 2022 and beyond. For your information, my name is Paul Colrain. I'm coming from Glasgow, Scotland right now. I've worked as a consultant for WHO and UNICEF in immunization supply chain logistics and EVM in particular since 2012. Next slide, Alex. Okay, so I'll present the EVM1 framework that we use to present and analyze the data. Before I present the actual EVM1 analysis itself. I'll then present the new EVM2 framework, analysis framework in some detail before introducing you to the Global Insights website, which will replace the PowerPoint slide deck that we used to produce every year with an analysis of the EVM data. The EVM1 data is so rich that we do not have time to present all findings, of course, but there is a PowerPoint slide deck with all of the highlights, which you can download from TechNet. So I'll pick a few illustrative findings, illustrative of the fact the EVM1 data set is, it's vast and it's full of interesting stories to tell. Next slide, Alex. Okay, so first, how was the EVM1 data organized for analysis and presentation? What is the EVM1 framework? So for data presentation purposes, EVM1 defined 4 supply chain levels. The primary level is the level where the national store normally resides. That's the level that receives vaccines from the manufacturers or suppliers or UNICEF supply division. At the other end of the supply chain are the service points, the SP level. That's where the immunization takes place. The level above the SP level is called the lowest distribution level. And every level in between, they are grouped together for presentation purposes as the SN level. There may be 0, 1, 2, or 3 SN levels. But when we present the data, we present scores for just these 4 levels. Next slide, Alex. Have you moved to the next slide, Alex?
Yes, this is the what does effective management assess? You don't see it?
I'm seeing the previous slide with the supply chain or the supply chain levels. I should be on slide 5.
Up. Well, sorry.
Yeah, that's it. That's it. Okay, so as I'm sure many of you know, EVM1 defined and assessed 9 areas of vaccine management. These are the so-called 9 criteria. I won't go into them in detail because I'm sure most of you are already familiar with them. These 9 areas are assessed at vaccine stores at each level of the supply chain, including the immunization service points. Next slide. Okay, for your information, E9 was changed in 2015. Immunization programs, as you know, they generate a huge amount of potentially hazardous waste. And EVM1 did not assess this in any rigorous manner. So this was changed in 2015. E9 became waste management, and the existing requirements were rearranged amongst the other criteria. So for that reason, we shouldn't pay too much attention to any time evolution of E9 scores in the following slides. Next slide, Alex. Okay, so for each of the 9 criteria, EVM defines requirements or standards. Each requirement is scored, and those requirement scores are aggregated to give criterion scores. And in turn, those criterion scores can be aggregated to give a composite score for each assessment. That's a single number that summarizes the performance of the supply chain within a country. So that's the EVM1 framework. There's requirements, they're grouped into 9 criteria, and these are scores that are evaluated for these requirements and criteria at each level of the supply chain and for each facility. Next slide. Okay, so let's look at the EVM1 data. Next slide. First, we'll look at some metadata before we actually start looking at the scores. Next slide. Okay, so this chart shows the rapid uptake in EVM1 from its inception in 2009 up to 2015, and the kind of subsequent deceleration in uptake in the last few years. Thankfully, EVM2 has reignited interest in EVM. There have been 25 EVM2 assessments in the past 3 years, and the demand is going through the roof. Next slide. Okay, now this map shows where the EVM1 assessments have taken place. As you can see, it's mostly in Africa and in Asia. The darker the color, the more assessments the country has done. Some countries have done just 1, some 2, some 3, some even 4. And I think one country has actually even done 5 assessments. Now with EVM2, we hope to spread EVM across the other parts of the world into Europe, the Americas, and the Middle East. Next slide. Okay, so now let's look at some of the scores. So first of all, we're going to look at the criterion scores using just the most recent assessments in each country. Next slide. Okay, so those of you who know EVM1, an EVM1 assessment produced 33 numbers or 33 scores. That's 9 criterion scores at each of the 4 supply chain levels. But E1 is only applicable at the primary level. So you end up with 33 scores when you complete a national assessment. So here in this chart, you see for each of the 9 criteria, you see the average scores for each supply chain level, averaged over the more than 80 countries that have conducted at least one assessment. First thing you see is the broad range of scores from 10% to 100% for these different criteria at the different levels. It is tempting to compare scores across criteria and across supply chain levels, but care should be taken when you do that, because not every criterion is assessed with equal rigor, and there are in fact different standards at different supply chain levels. But it is tempting. So what do we see? You can see that the scores get lower as we go down the supply chain, right? You can see that at the national level, the scores are higher than the subnational level, which are higher than the lowest distribution level, which are in turn higher than the service point level. This is a trend for all of the different criteria. So it seems that the supply chain is stronger at the national level. This is true for all criteria, except for E2, temperature management or temperature monitoring. And that's because the temperature monitoring standards are much higher at the national level and the subnational level. So the scores are in turn more. So that's the highest level view of the data that you get. there's a lot of aggregation across requirements, across countries and regions. So let's demonstrate how rich the data is. Let's dig a little bit deeper. Next slide. So let's look at some scores by region. Next slide. So here we see, for example, the E2 temperature monitoring scores for each supply chain level in each of the 6 WHO regions. The number of assessments are shown in the x-axis. So there's limited stats for some regions, but maybe you could argue that the Americas perform better than all other regions in this particular criteria of temperature monitoring. Note here again that these scores are higher at the lower levels, reflecting the stricter standards at the higher levels in temperature monitoring. And that pattern you can see across all of the different regions. Next slide. So here, for example, is the same, but for E3. E3 assesses storage and transport capacity. Same trend in all regions. The capacity is less adequate at the lower levels, but the scores are relatively high in all regions. The red line is at 80%. That's the EVM standard. We consider a score to be low and there to be room for improvement if any score is below 80%. Next slide. Okay, so here we have E6 stock management scores. Again, it appears that the Americas perform better than the other regions, but the Americas, there's only 4 countries here, but you can see that even their lowest scores tend to be higher than the median scores in the other regions. So that's just a little taste of that you can use the EVM data to compare different regions. Next slide. Go back. Yep, that's good. Okay, the EVM1 data set also allows us to monitor progress, right? So here we compare the first assessments versus the last assessments, and 64 countries have done at least 2 assessments. So that's our data set for the following slides. I'm just going to show a few examples. Next slide. So here we see the first assessment scores in green and the second assessments in orange. The 2 charts above and below show the same data but arranged differently. The top chart allows you to compare the supply chain levels, and the second allows you to compare directly the criteria. So what does the data tell us? Across all regions, all countries in all regions, you can see real but limited progress in all areas, except maybe temperature monitoring, that's E2, which showed no progress. You can also see real but limited progress at all supply chain levels. That means everywhere you look, the orange are a little bit higher than the green. Okay, now that's for all regions together, for all 64 countries together. Next slide. Okay, so here you see the same information, but just for the 36 African countries that have completed at least 2 assessments. And if we look at this region, you can see that the progress is much more significant, even in temperature monitoring. The orange, the last assessments, have higher scores than the first assessments in just about every criteria at every level of the supply chain. So it appears that EVM2, or sorry, that EVM is working. Next slide. Okay, so now let's mine even deeper into this mountain of data. Let's look at some of the individual question responses from the questionnaires. Again, the following slides use only the latest assessments for each country. The EVM1 global analysis slide deck has much more of this. I'm just going to handpick a few of the interesting scores. Next slide. So here we see some equipment data, in particular, highlighted. Just click again. Yeah, okay, highlighted it on the right there. You can see that about 50% of national stores do not have refrigerated vehicles for collecting or distributing vaccines. So this might have changed since. This is probably on average about 2018, so about 4 years ago, but it's quite significant. There's lots of scope for improvement in the transportation of vaccines across all of these countries. Next slide. Click again, Alex. Okay, now these indicators show stock management performance, right, of particular interest, highlighted. About 50% of primary stores were not always able to meet demand in the preceding 12 months. That's the 12 months preceding the day of the assessment. This number rises to about 70% for the lower levels. So EVM1 here is revealing some serious vaccine stock management issues. Next slide. Click twice, Alex, please. Yeah, okay. So what else do we have here? So here you can see, for example, that more than 75% of countries have not conducted a temperature monitoring study in the past 5 years. And 75% of cold rooms have not been temperature mapped. Okay, so EVM provides all of this, and this is just a snapshot of, you know, hundreds, close to 1,000 different indicators that you can actually analyze. Let's have one more slide. Next slide. Click twice, please, Alex. Yeah. Okay, so most vaccine stores, what do we have here? Most vaccine stores do not maintain an up-to-date inventory of cold chain equipment. You can see that in the first highlighted 3 bars. Okay, percentage of facilities with an up-to-date cold chain equipment inventory. It's 50% at the national level and much lower at the lower levels. So many countries, they do not have an up-to-date inventory of all of their cold chain equipment. On the right-hand side, what does that show? It shows us that more than 20% of national stores still have paper-based vaccine stock management systems. Right, so that's probably improved in some countries since then. This is on average about 2018, so about 4 years ago. So that's a little snapshot of some of the data from the last assessments of all of those 80 countries, 80 or so countries that have completed EVM1 assessments. Next slide. Okay, so here we're going to look now, yeah, so as interesting as these snapshots are, their time evolution is even more interesting. So EVM1 allows us to watch the story unfold by comparing first and last assessments. And as I said, 64 countries have conducted at least 2. So we have data here for about 64 countries. So let's have a quick look. Next slide, please, Alex. If you could click twice, Alex, please. Okay, so highlighted at the top, we can see that there's been significant progress in temperature monitoring equipment in cold rooms and refrigerators. The green shows the percentage of facilities in which all cold and freezer rooms have continuous temperature recorders. That's the top one. The next one down is for refrigerators. And the orange shows the last assessment. So you can see between first assessments, which were done mostly around about 2012, to the last assessments, which are on average about 2018, you can see a significant improvement in the temperature monitoring equipment that's being used. Next slide. Click 3 times, please, Alex. Okay, so what do we see here? The first one, there are many more national cold chain equipment inventories. So we highlighted earlier that still many facilities do not have inventories of their equipment, but we can see that it is changing. Things are improving. We have data there just for the national store, and you can see that the percentage of national stores that have cold chain equipment inventories of all of their equipment has increased from about 40 to about 60%. The second chart tells us that there are less landline telephones at all levels. This is interesting. I myself don't have a landline telephone, so that story has been told across vaccine stores as well. The last one also shows us that at each level of the supply chain, there are more computerized stock management systems between the first and last assessment, so that's good to see. All of these represent significant progress. So by looking at this data, it appears that EVM is working alongside other efforts, of course, to improve immunization supply chains. Anyway, that finalizes our brief look at EVM1. Now let's look at EVM2, the EVM2 data analysis framework, and our plans for putting that data, at your fingertips rather than within a PowerPoint slide deck. Next slide. Okay, so the EVM2 analysis framework. It's inspired by the EVM1 framework, but also by a framework that's used in economic analysis, which some of you may be familiar with, and also by United Nations monitoring and evaluation guidance on indicator types, input, output, performance indicators. We've tried to incorporate best practice into the analysis framework. It's also inspired by a need to assess not just the facilities where vaccines are stored, but also the program management, because the root causes of a lot of the issues found in the facilities is often issues at the program management level or even above. So in EVM2, we expand the framework to assess not just facilities, but also program management at the national level. Next slide. Okay, so those of you familiar with economics, you will know that economic output is often modeled as depending on the availability of 3 or 4 or 5 types of or categories of inputs called factors of production. Car manufacturing, for example, it requires land, capital, and labor, right? In other words, if you want to build cars, you will need infrastructure, right? The land, the roads, the electricity, the water, the telecom links. You will also need buildings and equipment, that's the capital, and you will also need human resources or labor. The fourth factor there, knowledge. This encapsulates data, evidence, best practice, processed and presented in policies and procedures, right? So this factor was added to this modeling as the knowledge economy developed. The fifth factor, enterprise, that's the know-how and inclination to bring the 4 other factors together, in an endeavor to produce an output for whatever reason, most often profit. Not particularly relevant for the immunization supply chains. What else do I want to say here? So this same model can be used for all industries. You can see here car manufacture, dairy farming, coal mining. It can also be used for individual businesses. Click. Alex, if you can click twice. Yeah, perfect. Click twice again. Okay, good. So that same model can be used for all industries and also for individual businesses, like running a restaurant, or for individual tasks like baking a cake. You can use this framework for any type of function, any type of task. So all of these functions, they require certain inputs if they are to achieve their desired outcome or performance, which might be profit, it might be just to put happy faces on customers. But also each of these functions generates outputs as it is carried out. These outputs can be used to see if the function is operating as it should, if staff are carrying their tasks according to policies or SOPs. Okay, so that framework that you can see there, that's a similar framework which is used in economic analysis, but it's also the framework that we've borrowed and brought into EVM2. Next slide. Yeah, so here as an example, just take the restaurant, for example, right? Now, a restaurant requires certain infrastructure, land. It requires electricity, water, sanitation. It also requires capital. That means equipment, cooker, refrigerator, van. It requires labor, chef, cleaner, waiter. It requires knowledge encapsulated in menus and recipes. And it generates certain outputs as the restaurant operates. So orders, stock records, is the kitchen clean, is the restaurant clean and well organized? And ultimately, It either performs well or it doesn't. Now, the performance is measured depending on what your desired outcome is. If your desired outcome is nothing other than to make profit, then you would measure profit. If your desired outcome is to put smiles on people's faces, then you would measure the happiness of your clients through some kind of feedback mechanism. So there, if you wanted to assess a restaurant, you would assess each of the inputs, you would assess the outputs, and you would assess the performance. If there are issues with performance, then you can do a root cause analysis. You can go back to the outputs and look if the outputs are all in place. If not, you can look back and see which of the inputs are not in place to try and help you understand why the outputs and the performance ultimately are not as you expect. Next slide. Okay, Alex, just flick through. That's enough. Yeah, go back one. Yeah, okay. So based on these ideas, we have the EVM2 framework for data analysis. So in a few bullet points, EVM2 sets standards for the immunization supply chain. EVM2 sets standards for the inputs, the outputs, and the performance of specific supply chain functions. EVM2 sets standards for functions that are carried out at the vaccine stores and the immunization service points. But now in EVM2, we also set standards for the functions carried out at the program management level. Now, the input standards, as I've said, they're grouped. They're grouped into 6 EVM2 categories, similar to the factors of production that I just showed you. And just for your information, I will use the term standard and requirement interchangeably as we go on. Next slide. Okay, so here you can see EVM2 defines 9 facility operations functions. That's the same 9 functions that were in EVM1, but EVM2 also defines 4 facility management functions. You can see them at the bottom: annual needs forecasting, annual work planning, supportive supervision, and supply chain performance monitoring. Right. These functions were actually assessed in EVM1, but not explicitly and not rigorously. They were kind of scattered amongst the other criteria. These management functions are included in this WHO mid-level managers definition of key management functions. So that was also an inspiration. So EVM2 also defines 6 input categories. If you look at the top on the left, the column headings on the left, they're similar to the factors of production, but they have slightly different names to make them more appropriate for our needs. So you have C1, which is infrastructure. So that's roads, electricity, sanitation, telecommunications. You have C2, which is all of the equipment that's used to move and manage vaccines. C3 is also equipment, but it's the equipment that you use to manage data. So it's computers, it's software, it's scanners. C4 is labor or human resources. C5 is knowledge, which we call evidence, policies, and procedures. And C6 is something unique to EVM, not included in the factors of production model. That's financial resources. Financial resources are not usually included in the economic analysis, but given that there are many issues with funding of operations at vaccine stores and immunization facilities, we felt it was important to allow EVM2 to capture that information and hopefully address it. So on the right, you will also see the EVM2 also assesses the outputs and the performance of each of these functions. Okay. Let's just, next slide. Okay, just as an example here, E6 stock management. Okay, E6 stock management, you might need a computer. Ideally in the 21st century, it should not be paper-based. You might need some software, okay? You might need some trained staff, and you might need some SOPs, guidance documents on how to do that. The outputs, of course, are the stock records, the issue vouchers, the receipt vouchers, and your performance is, you know, that your vaccines are always available, that you don't have any stock out. So that's just a very brief picture of how this framework might be populated for one of these functions, right? So in each of these cells where you see a little tick, there could potentially be requirements. So for stock management, there'll be requirements on the computer, there'll be requirements on the software, there'll be requirements on the staffing, training, knowledge, there'll be requirements on the guidance that the staff have to carry out this function. On the outputs, there'll be requirements on the, the completeness and accuracy of stock records and issue vouchers and so on. And also, you will measure performance by looking at whether or not the stock management has performed as desired and that vaccine is always available. Okay, let's, in the interest of time, go next slide. Okay, so here, for example, remember I said that EVM2 also wants to assess program management. So the facility operations E1 to E9 and the facility management functions M1 to M4, they're carried out at the facilities and they need 6 different types of inputs. So who provides those inputs? Well, it's the program management. So EVM2 defines 7 program management functions carried out by staff at the national level. So the API manager, the supply chain manager, the cold chain technician, the data manager, and so on. Those functions are listed here. Right? These are the functions that we assess at the national level, at the program level: strategic planning, infrastructure management, equipment management, IT systems management, human resources management, knowledge management, and financial resources management. So you can see that that's R1 to R6 correspond to C1 to C6, the input categories for the facility operations and management functions. Let's, next slide. So here for an example, right? Let's look at equipment management. If that's your job, you might want some equipment management software, right? You will need to be trained. You will need policies on what type of equipment to procure, how often to replace it, etc. And of course, you'll need a budget. Okay, so you can see them reflected. If you do your job well, if you perform well, then all of the facilities will have good quality equipment in good condition. A critical output in your cold chain equipment management is an up-to-date cold chain equipment inventory with all equipment, make, model, age, functional status, location, etc. Okay, so if you were assessing equipment management, you would have requirements on the software, on the training of staff, on the knowledge of staff, on policies and procedures for equipment management, on funding for equipment management. And on the other side, you would have requirements on the availability of an up-to-date inventory and also requirements on the availability of the equipment at all of those facilities. So that's a little example of how you would populate the EVM2 framework. Next slide. Let's go to the next slide in the interest of time. Okay, lastly, EVM2 assesses the performance of the supply chain as a whole at each level of the supply chain and at each facility. So here, this supply chain function is presented using the same framework that we use elsewhere. How do we measure the performance of the supply chain at a specific location? Well, when all of the facility operations and facility management function as expected, the supply chain should perform well. There are 3 aspects to supply chain performance. Next slide. Click 3 times. Thank you. Okay, so the performance of the supply chain function at each of these facilities is measured in 3 different ways: availability, quality, and efficiency. So at each facility where vaccines are stored and immunization services are provided, each facility should always be able to meet the demand for vaccines and syringes. We assess that. The available vaccines and syringes are in good condition. We assess that. So not temperature damage, not expired, no labels falling off and so on. So we assess that. Also, the supply chain should be efficient. The way we assess that is just by measuring vaccine wastage, that there's no wastage of actual vaccines. or that it's kept to a reasonable minimum. So at each facility we visit during an assessment, we also assess the availability, quality, and efficiency of the supply chain, and we score these. Okay, next slide. Click once. Okay, so here you can see the EVM2 framework in its entirety. EVM2 assesses the inputs, outputs, and performance of program management. It assesses the inputs, outputs, and performance of the operations and the management of vaccine stores at each level of the supply chain and at immunization service points. EVM2 also assesses the performance of the supply chain overall at each vaccine store and immunization service points. Now you can see that the performance of the program management functions R1 to R6 is actually numerically equal to the quality of the inputs to the facility operations and management. Okay, next slide. Anyway, that's all well and good, okay? But who will have access to this EVM2 data, and how will they access? So what I'd like to introduce you to now is the future, this Global Insights website. So I'll now show you some screenshots from the EVM Global Insights website. It's under development, it's ready soon. This will replace the annual PowerPoint slide deck that will be updated every time a country completes a national assessment. And the EVM1 data will be included as well, allowing us to track progress of certain indicators across time back to 2010. This website will not provide access to any individual facility data, only aggregated data at supply chain level, at national level, regional, and global level. Okay, so next slide. So this is the current homepage. It's under construction, it's being tested. It should be ready by the end of the year. At least some of the functionality will be ready for the public at the end of the year. Next slide. Click once, Alex. Okay, so here there is a menu of dashboards that are available, okay, allowing you to see a snapshot of criterion scores or category scores or requirement scores at one point in time. But also there are dashboards that allow you to see the time evolution of scores, and also dashboards that allow you to compare different regions, different countries, and so on. Next slide. Okay, so here what you see is the most popular of the dashboards. This dashboard is actually available for an individual facility, but that's not public. If you have access to a country's data, you can see this dashboard for an individual facility, but the public will be able to see it, the aggregate scores for supply chain levels, for countries, for regions, and globally. Okay. Now on the left, you can select the supply chain level, you can select the region of the world, and you can select the year up to which you want to aggregate all of the data. Next slide. Here, for example, you see, well, actually, just go back one, Alex. Okay, are we on the same one? Go to the next one, Alex. Next one. Right, okay, that's good. Let's stay there. Okay, so here, for example, we've selected on the left just the service point level and the African region. Okay, and you can see there's been 11 EVM2 assessments if you look at the top. So this dashboard is showing you the scores in each cell. So each row, this heat map is a mirror of the EVM2 framework. You have the columns, the input requirements, the output and the performance, and the rows are E1 to E9 and M1 to M4. You can see that some of the cells are empty. That's because there's no requirements defined within those cells. Where you see green, it means the score is above 80%. That's considered the EVM standard. Where it's red, it's below 50%, and everything in between is yellow. So this is a popular dashboard for looking at assessment results, but also you can look at this on a regional level or even at a global level. Next slide. Now, you can also use this dashboard to select one of the 3 heat maps. Remember, there's a heat map for the facility operations and management functions. There's a heat map for program management, and there's a heat map for supply chain performance. So you can see the heat maps for each of those dashboards. Also, if you click once, Dan, Alex, so you can also, with this dashboard, you can click on any one of the cells and it will take you to another dashboard which shows you the underlying requirements and the scores, the aggregate scores for those underlying requirements. You can even go deeper and look at the sub-requirements, okay? So let's click on that cell. Next slide. So that cell was E7C4. That was vaccine distribution, human resources. Okay, so the score is, I think, 47%, indicating a low score, area for improvement. That was across the Afro region, telling you that HR for distribution scores low. Now, if you click on that cell, you see this dashboard and you see that there are 3 different requirements. 2 or more members of staff are assigned to carry out vaccine distribution tasks. Responsible staff are trained how to carry out vaccine distribution tasks, and responsible staff are knowledgeable. So it's about the availability of staff, the training of staff, and their actual knowledge. Okay, so you can see the underlying requirements. Next slide. Okay, now just very briefly, there are other dashboards being prepared that allow you to do such things as see a time series of scores, to compare scores in different regions, to compare scores across all regions, to compare scores at different points in time for a given country or region. And also there's a map which allows you to see scores for different countries shown on a map of a country or a map, a global map. Just as an example, next slide. Oh, sorry, you're already there. Yeah. Next slide, please, Alex. Next slide. Yeah, okay, so we're here. So here, for example, you see, what does it show us? It shows us E6 information system. So that's E6 and C3. And you can see the aggregate score in each of the different regions. Okay, so this Global Insights website will allow you to cut the data up in different ways, analyze it in different ways, and it will be at your fingertips. You won't need to wait for 6 months after the end of every year for the PowerPoint slide deck to appear. The data will be updated every time a country completes a national assessment. So that's a taster of what's to come on the Global Insights website, so please watch this space. And with that, I'll say thank you, and I'll hand over to Alex. So thank you very much. I'm happy to take questions. Next slide.
Thank you. Thank you very much, Paul. So there are 2 questions for the moment. So don't hesitate to ask your questions in the Q&A box. If you cannot find the Q&A box, just don't hesitate to ask the question in the chat. So first question from Surya Prakash Misra, who's asking, how can we ensure that the temperature across the supply chain remains similar at the national level?
I didn't quite understand that question. Say that again, Alex.
Sure. How can we ensure that the temperature across the supply chain remains similar at the national level? Not sure this question is clear. So perhaps, Surya, perhaps you can clarify this question, right?
Well, just to, I mean, the EVM standard, every vaccine has its recommended storage temperature. Countries, yeah, so, and there are guidelines for countries on the temperature monitoring equipment that every cold room and vaccine refrigerator should have. There are also requirements on temperature monitoring, manual temperature monitoring, computerized temperature monitoring at different levels of the supply chain. And the specifications of these software are defined. WHO actually pre-qualifies different temperature monitoring systems provided by a few different manufacturers. So there are lots of EVM standards on equipment, software, policies, standard operating procedures, training, all in the area of temperature monitoring, and also on the expected outputs, the forms, and on the expected performance, meaning no temperature alarms, high or low, no damage to vaccines from high or low temperatures. So by following these recommended standards, which are documented separately and can be used as reference, countries can implement the necessary systems to manage vaccine temperatures.
Thank you. Looks like your answer is satisfying for Surya. There's a comment from Philippe Jaillard. In general, progress has been slow despite the efforts to assess, plan, implement, assess, plan, etc. It would be interesting to know which interventions or levels of financial resources have resulted in the greatest gains by criteria and category and by country, in order to better direct resources or replicate some of the most effective approaches or investments. Anything you'd like to say on that?
Well, I agree with absolutely everything. It's not a question, it's a comment, and it's
a
very,
comment.
very good comment. Yeah, no, definitely. In the past, one of the weaknesses of the EVM program, not necessarily the assessment, but the program, was that assessments were done, but the resulting improvement plans were either not fit for purpose, addressing maybe equipment, but not training and not procedures and policies. And also quite often these improvement plans were not funded, responsibilities were not clearly defined, and so they didn't actually get implemented. So with EVM2, there's a new effort to try and work with countries to develop, better, more actionable, funded improvement plans, and to stay with the countries as they implement these improvement plans during the cycle of improvement. So I agree, more effort is required. The EVM data does probably allow you to see where, in conjunction with funding, probably does allow you to do some kind of analysis about the effectiveness of funding in different areas, the impact on scores, but it's a very, very complicated analysis given that many other factors affect the performance of the supply chain and also of immunization coverage.
Thanks, Paul. There's another question. There's a question from Nadira Sama. There is training needs for staff in countries where they're like fragile health systems and under war or political conflicts. Is there a support to these countries in the Middle East? And partnership status, where do we stand, please? And thanks for the efforts.
There are training programs. EVM has itself, as part of the EVM program, there are EVM training resources. There are training resources for EVM managers. There are training resources for EVM assessors. In EVM1, there was a very good training package on vaccine management, which we hope to update and strengthen in EVM2, but we've not got there yet. So place to go would be to the EVM website and also to the TechNet website and click on the EVM topic. There you will find lots of training resources and guidance on where to go if you're looking for training resources. There's also an excellent UNICEF, I think it's Agora, online vaccine management training course, which you can do online. And I know that some countries have encouraged their staff to do this training. So that's another. I think on the EVM topic on the TechNet website is probably the best place to go to find a full set of all of the resources that are available.
Yes, and Dan Brigden just shared the link to the TechNet website in the chat. So folks, just go there and click to access directly this page. There's a question. I'm not. I wouldn't understand that actually, but Paul, perhaps this is clear for you. This is a question from Edwin Papai. EVM assessment tool. Does EVM assessment tool conform with WHO tools LIAT, I don't know, LSIT or VMAT? Does it ring a bell to you?
No, I've no idea. These may be some standards that are defined somewhere else. I don't know. Maybe Dan might know. Maybe Dan can answer in the chat. I'm not sure, but I certainly don't. I'm not aware of these numbers.
Dan, if you know something about that, let me know. I can open your mic. Right. There's a question. Well, this is a general question, and you already mentioned a little bit in an answer earlier. Question from Yusuf Sabil. How long can vaccines be exposed to elevated temperature? This is a vague and broad question. Well, this is a broad question.
Well, it depends on the vaccine.
That's
I mean, some vaccines like OPV are very temperature sensitive, and short periods out of the cold chain can be, damaging to the vaccine. Other vaccines are less sensitive to high temperatures and can spend more time. Luckily, on most vaccines now, we have a little monitor of heat exposure, which tells us when the vaccine has been exposed to too much heat and is no longer usable. So as I say, it depends on the vaccine. This little monitor is called the Vaccine Vial Monitor, the VVM monitor. All UNICEF procured vaccines now have this VVM monitor on it, and many other vaccines. So this is a great development. In the past, when vaccines were kept out of the supply of the cold chain for a short period of time, you're obliged to bin them, even though they were still, potent. So this VVM helps to save a lot of vaccines and put the mind at ease of the healthcare workers and the caregivers.
Yes. So there's no other question. Well, there's a question asking if there's any certificate of participation. There is no certificate of participation for this session. TechNet will will do certificates at a later stage. Some questions perhaps before we make. So there's a comment here from Suleiman Yusuf Ali that says before we make the EVM, we need training and all equipment and staff well known. I'm not sure I understand this comment.
Yes, of course, it's very clear. I mean, any country or any supply chain manager who's interested in using EVM, they should contact WHO. Maybe Dan, you want to put the contact email address. You can be supplied with, all of the necessary resources, and a support will be provided to you to acquire the knowledge and to set up the website to be able to use EVM2.
Okay, thank you, Paul. There might be a clarification from Edwin about the standards evoked shortly earlier. Logistics Indicators Assessment Tool, LIAT. Does it ring a bell?
No, it doesn't ring a bell, but it's something that I've probably read at the start of this development of EVM2 framework. I reviewed a lot of different UN documents on monitoring and evaluation, so I may have inadvertently actually aligned the EVM2 framework with those definitions, but I'm not sure.
Okay, yeah, there's another Logistics Systems Assessment Tools, LSAT, or Vaccine Management Tools. These are tools used by WHO in monitoring vaccines.
Yeah, these sound familiar. Yeah, I think they were reference documents that were used, yeah.
Okay. There's no other question. So you have 1-2 minutes left if you want to ask a last question. No more question. Then I think we can wrap up this session. Oh yes, there's a question. Haha, you're not done yet, Paul. Not on the weekend yet. Is there any expected time to know that a vaccine is not usable after exposure to an expected temperature? question from Emmanuel Agou. It's
yeah, well, as I said,
yes.
The VVM is the only way to know with any certainty that a vaccine has been exposed to too much heat and is no longer potent. Low temperatures is another thing. There are some vaccines which are freeze sensitive. So if they're ever frozen, then they cannot be used. They're no longer potent. There is a way, it's called the shake test. There is a way to test whether a freeze-sensitive vaccine, that's a vaccine with aluminium adjuvant, has actually been frozen. So there is a way you can test whether it's actually been frozen. You might have an indication that it was frozen, maybe a low temperature alarm, but you're not actually convinced that it was frozen. So you can do this little test, and that will tell you with some confidence whether or not it has been frozen, but that's quite complicated. Some countries choose not to implement the shake test. Yeah, there are various ways of determining whether or not a vaccine is still potent and still usable. The VVM is the main one for heat sensitivity, and the shake test is used for freeze exposure.
Okay, thank you. There are no more questions in the Q&A box. 3 people are raising their hands, but it's already 4 o'clock. Unless you want to take 1 or 2 questions, Paul, it's really up to you.
Yeah, let's do 1 or 2 more. 2 more.
2 more. So Edwin already asked the question. Oh, so we have the Edwin, and let's ask Edwin to clarify perhaps the question on the standards. Oh, Edwin is not raising the hands anymore. So we have 1 person asking. Give me a second. I'm trying to. So, Emediong, you can unmute yourself and ask your question. Emediong, yes. No, he's not raising the hand anymore. So I think we're done. We scared them away. Thank you so much. No, Emediong again. So Emediong, look, if you're raising your hand, you can unmute yourself. You have the possibility to unmute yourself. Go ahead.
Oh, sorry, it was a mistake. Please, I saw you didn't scare me away. Thank you.
Okay, so it was a mistake. No problem. Great. So I think, Paul, would you like to add anything else?
No, I'd just like to say thank you very much for this opportunity, and thanks to Dan and yourself and Fred for this series of webinars. I think it's very, very good that we promote EVM2, and I think this is working really well.
Yes, indeed. So we're going to share all the materials by email early next week. You'll have access to the videos, the recordings in French, in English, and the presentations. We'll send also perhaps a reminder of the EVM page so that you can find all the material that can be useful on this topic. I wish you all a very nice weekend and end of the day for those who are, in the afternoon, late afternoon, evening, or rest of the day. And hope to see you again soon for next webinar sessions. Bye, everyone. Bye.
Bye. Thanks, Alex.
Thanks, Paul. Bye.